Thank you for entrusting us with your orthodontic care. In general, the informed consent can be viewed as a series of risks that patients should be made aware of prior to beginning treatment. In general, the risks are minor. However, a few of these are important as they may have long-lasting effects on the teeth and the results of treatment. Please note that these are general risks related to treatment and are not specific to any particular patient or treatment plan. Number 1. Oral hygiene. The first risk to be aware of is white spot decalcification. This is preventable with good oral hygiene. The most important aspect of oral hygiene is toothbrushing, ideally using fluoride toothpaste. Although a Sonicare toothbrush is preferred, the type of toothbrush that is used is not as important as just simply making sure to brush the teeth in the morning after breakfast and every night. We ask that an adult supervises a child's brushing on a nightly basis to ensure there is no plaque left behind, focusing on the gum line and around the braces. Number 2. Root resorption. The second significant risk associated with treatment is called root resorption, which is the shortening of tooth root length. Unfortunately, some patients can show significant root loss, as much as 30 to 40% on a single tooth. Patients that are at the greatest risk are those that have had previous trauma or injury to the tooth. The causes of root resorption are not fully understood, and it is not possible to predict which patients will show significant root resorption during treatment. It is rare that Dr. Freeman has to modify a treatment plan due to root resorption. Number 3. Lifetime retention at the end of orthodontic treatment. We are all accepting of the aging process when it comes to changes in our vision, hearing, skin, or even our hair. However, families are often upset to see that teeth will move without appropriate retention. There are two possible types of retainers available: removable retainers and fixed retainers, also known as bonded or permanent retainers. If during treatment oral hygiene has been poor or there has been excessive breakage of braces, Dr. Freeman will not recommend placement of bonded retainers and instead will provide a removable retainer in its place. Number 4. TMJ. Please know that Dr. Freeman does not recommend orthodontic treatment as a way to correct jaw joint pains or popping or any other TMJ disorders. Additionally, he cannot recommend treatment as a means to correct lip biting. Our office does not fabricate sleep appliances such as bruxism appliances or night guards of any type. Number 5. Previous trauma. Sometimes teeth that have experienced trauma, deep fillings, or other extensive restorative dentistry such as crowns and bridges may ultimately require root canal treatment. Number 6. Managing discomfort. The first week of treatment is typically the most difficult to adjust to. Dr. Freeman recommends the patient takes ibuprofen as a preventative rather than taking a wait-and-see approach. Be aware the discomfort associated with treatment often takes 12 to 24 hours to present itself. But don't worry, you can continue with your normal activities immediately, including the day that braces are placed. You will want to eat softer, high-calorie foods for the first few days. Number 7. Patient comfort. On rare occasions, it is possible that a patient may get poked or scratched while we are working in their mouth. Additionally, it is possible that an orthodontic appliance, such as a band or a brace, could be accidentally swallowed or aspirated. It is highly unlikely that an appliance would ever be aspirated. Please know that it is very important to protect the mouth while participating in contact sports. Never use a boil and bite mouthguard with braces. The mouthguard will become locked into the braces and you will be unable to remove it. Dr. Freeman typically sees most sports injuries from participating in pickup games of basketball, baseball, and softball. We will provide you as many sports mouthguards as you require. Number 8. Headgear. It's very rare for our treatment plans to include the use of headgear. However, if it is required, please be aware that headgear is attached to the face and therefore extra care needs to be given when a patient is wearing one. A headgear is only to be worn during periods of calm activity and never while playing. Number 9. Ceramic braces. The vast majority of patients choose to use metal braces. However, we also offer upper ceramic or clear braces. If the idea of having bright colors on your braces sounds preferable to you, we recommend using the metal braces. It's important to know that ceramic braces are slightly thicker and can be chipped or fractured depending upon different foods you eat. Ice cubes would not be a good idea, as well as whole nuts, such as almonds, which could also pose a risk of fracturing the ceramic braces. Also, be aware that metal braces provide a much more comfortable removal process than the ceramic braces. Number 10. Extractions and surgery. Some treatment plans, including cases of severe crowding or protrusion, may necessitate tooth removal, also called extractions. Patients that have severe jaw imbalances may require jaw surgery in conjunction with orthodontic treatment. The risks involved with treatment rendered outside of our office is best discussed with the dentist or oral surgeon providing the service. Please consider the costs, risks, and benefits of all treatments before making a treatment decision with our office. Number 11. Jaw growth. Although rare, it is possible some patients may show disproportionate jaw growth during the course of orthodontic treatment. Growth disharmony is a biological process beyond the control of the orthodontist. In severe cases of disproportionate growth, the bite may change so significantly that additional treatment, including jaw surgery, may be required to bring about a balanced bite and facial profile. Number 12. Interproximal reduction. In cases of mild to moderate crowding, a small amount of enamel may be removed from between the vertical surfaces of adjacent teeth, thereby reducing width and creating space. This is called interproximal reduction, also known as IPR. IPR removes only a small percentage of the enamel. Numbing is not needed. Teeth that have had IPR performed on them are not at a higher risk of decay and will not become cold sensitive. Number 13. Black triangles. Adult patients who have some amount of recession, as well as overlapped teeth for long periods of time, are likely missing the gum tissue below the contact between teeth. Please know that after initially crowded teeth have been aligned, additional gum tissue does not grow back. This creates what is known as a black triangle space. IPR can be used to reduce the black triangle, however, the black triangle may not be fully eliminated. This is a risk of straightening long-standing crowded teeth in adult patients. Number 14. Impacted or unerupted teeth. Sometimes patients present with adult teeth which will not erupt on their own into the mouth. This is known as impaction. Please know impaction cases typically incur an increased treatment time. Additionally, care of impacted teeth often requires exposure and bonding, which is a minor surgical procedure to put a brace on the unerupted tooth. While uncommon, the process of bringing impacted teeth into the mouth may result in damage to the adjacent teeth, as well as a result in a small area of gum recession. Number 15. Treatment time. The total time required to complete your treatment plan may exceed the treatment estimate. Sometimes the reasons are outside of the control of the orthodontist or the patient. This includes the rate of tooth eruption or extraction space closure. More often, poor cooperation on the part of the patient adds to the overall treatment duration. The patient's willingness to cooperate with elastic wear, food selections to avoid broken brackets, and attend appointments regularly is vital. Rubber bands are used to bring the upper and lower teeth towards one another. If the rubber bands are not worn, the bite can't be corrected. We often have patients go throughout treatment without breaking a single brace. At the same time, we understand that most patients will have a few broken braces, maybe 3, over the course of their treatment. If the patient is experiencing multiple broken braces, please consider what foods are being chosen. Hard candies and ice cubes, as well as non-food items such as pens and pencils, will always result in broken braces. Should a brace break and you notice the brace is no longer attached to your tooth, please notify the office, and please make sure to attend appointments regularly. Number 16. Scheduling. Longer appointments, such as the placement of braces or the removal, are scheduled during the mid-mornings. We do this to ensure we have the greatest number of appointments to offer during the most requested times, before and after school and the workday. Number 17. Tooth size and shape. Some patients present with variation in the size and shape of the upper incisors. If the patient has smaller incisors, please be aware that the most ideal result may require restorative treatment from their general dentist. Number 18. Medical history. Please keep us informed of any changes in your health that may impact your orthodontic treatment. Number 19, first phase. If this treatment is a first phase of treatment, the need for a second comprehensive treatment should also be assumed necessary. Second phase treatment begins following the eruption of all permanent teeth. Remember that orthodontic treatment is elective, and an alternative to treatment is no treatment at all. Emergencies. Although rare, an orthodontic emergency would include dental trauma resulting in a loose or displaced permanent tooth, or a lip or tongue hooked in a brace. Should this occur, contact the office immediately. If you have any additional questions about the informed consent, please let us know. Thank you for entrusting us with your orthodontic care.